there's a trend towards attempting simple and effective solutions prior to considering more invasive surgical procedures. At the Feet for Life Centers, we've adopted a protocol that is time-tested and very effective for treating neuromas of the forefoot.
Now, oftentimes people ask me, how can you accurately know that you're actually hitting the part of the nerve that you want to hit? Well, we've shown you if you have a high-quality diagnostic ultrasound, you can actually get right on the part of the nerve that you need to hit. But what most people don't understand until they actually see it is that the ice ball that's created with the probe is actually very thick. Now here's the ice ball. We just pulled this ice ball out of saline. We've created it for the purpose of this demonstration. And all we're going to do now is simply just show you a depiction of how the ice ball contacts the nerve and where it contacts the nerve and how that solves the problem. The ice ball comes into contact with the nerve, and it's very difficult to miss the nerve with an ice ball this size. So we're hitting the proximal portion of the nerve with this ice ball. After a while, the ball actually sticks on the nerve, as I demonstrated on the diagnostic ultrasound, and you can pull on it.
So this procedure starts off with a lidocaine block of the inner space that we're treating. In this case, we're applying a small amount of lidocaine to the inner space and using some alcohol to clean off the foot before we start. There you can see the cryosurgical control unit and the diagnostic ultrasound. Now what we're doing here is we're making a very small incision with a 14 gauge needle. And that incision is so small that it very rarely requires even one stitch.
And let's turn up the pressure. Just keep going. Good. Good. Beautiful. So this probe has a tip that forms an ice ball on it. And all we're going to do is insert the probe beneath the deep transverse metatarsal ligament through the little incision that we made. And what that allows us to do is to get right on the nerve. And just check my probe placement. Bill, if you can hit the freeze button. There we go. I can see right there my probe very clearly. And I can see where the nerve is. I can see exactly where I need to put the probe in order to be right on the nerve. A very useful tool. Right now, the tip of the ice ball is right next to the nerve, so I know I'm in a good position. I'm going to go ahead and let the pedal off, and we're going to do a 2-minute and 30-second freeze. When you have a nice ultrasound like this is an $80,000 machine, you're able to see things very clearly. So you can watch, in this case, you can even watch the ice ball form, which is unbelievable. I mean, the technology's come a long way. There, okay.
1 minute.
Now, get that picture, Dave. That is just beautiful. Yeah. Bill's outlining for you the actual ice ball that's forming inside the foot on the nerve. You can see the probe and the ice ball. If I adjust the ultrasound just right there, it looks like a giant black Q-tip. Now, you're only going to get this image if you use the top piece of ultrasound gear. It's just not going to show up on cheap ultrasound. But there's an amazing picture of how large the ice ball is and the area that it's covering. As long as you know you're close to the nerves, you're in great shape.
So now we're able to power down the machine, turn down the pressure of the gas, and the procedure comes to an end. The patient has had 2 or 3 freezes and thaws, and it is interesting to note that it is the thaw that actually causes the lesion on the nerve that creates the decrease in the amount of pain and temperature that is felt after the procedure. Now we're dressing the patient with the compression dressing, and she'll wear that for approximately 24 hours. And the next day she's up and she's able to get on the foot and actually even take a walk or go for a short hike after this procedure, which is absolutely amazing. And that's why we like the cryosurgical treatments much more than the cutting procedures that have historically been performed.